This is Plant-Based Briefing. NIH's initiative to prioritize human-based research is a big win for animals, says Doctors Group. From Physicians Committee for Responsible Medicine at pcrm.org. And I'm Marian Erickson, host of this curated content plant-based podcast, where I narrate a variety of articles on plant-based and vegan living with permission in about 10 minutes or less every weekday. And I'm pleased to have permission from the Physicians Committee to share their amazing content. They do all kinds of wonderful work, including educating people by issuing press releases on important information, which is what today's article is. It's a press release from April 29th, 2025. So now let's get to today's plant-based briefing. NIH's initiative to prioritize human-based research is a big win for animals, says Doctors Group. From Physicians Committee for Responsible Medicine at pcrm.org. The nonprofit Physicians Committee for Responsible Medicine, which promotes the use of human-based research to improve health and replace animal use, enthusiastically supports the U.S. National Institutes of Health's landmark commitment to prioritize innovative human-based methods like organoids, tissue chips, computational models, and real-world data analyses, while reducing animal use. NIH Director Jay Bhattacharya's historic announcement that the NIH will prioritize human-based science is not only a big win for animals, but also for human health, says Catherine E. Krebs, Ph.D., Medical Research Program Manager for the Physicians Committee for Responsible Medicine. We've known for a long time that animal experiments don't reliably translate to human health outcomes, coming at a grave cost to patients in need of better treatments, to innovation, and to animal lives. Animal experiments are poorly representative of human health and disease and rarely predictive of drug efficacy, safety, and toxicity in humans. The reliance on animals is a direct contributor to high failure rates in the drug development pipeline, wasting billions of dollars each year and putting trial participants and patients at risk by failing to capture unsafe or ineffective products. As a result, untold numbers of dogs, cats, monkeys, mice, rats, and other animals are bred and used in painful and deadly research and testing procedures, estimated to be greater than 100 million per year in the United States. Innovative 3D in vitro technologies like tissue chips, organoids, and bioprinting, as well as advanced computational modeling and real-world data analyses, are already being used to replace animals in a variety of applications, including disease modeling, precision medicine, and regulatory toxicology. These pioneering methods, also called New Approach Methodologies, or NAMs, use human cells, tissue, and data to replicate human-specific biology and disease characteristics, and have enormous potential to revolutionize medical research and testing. The announcement details several agency actions to better prioritize innovative human-centered research, including establishment of the Office of Research Innovation, Validation, and Application, or EVA, to coordinate NIH-wide efforts to develop, validate, and scale up the use of non-animal approaches, and serve as a hub for interagency coordination and regulatory translation. To promote the broader use of non-animal approaches, ORIVA will expand funding, training, and infrastructure, and help raise awareness of their value in translational success. New funding opportunities will include evaluation criteria that assess methods based on their suitability for the research question, context of use, translatability, and human relevance, factors which should help improve review quality and ensure impartiality toward different methods. To also aid in the review of non-animal research proposals, grant review staff will participate in mitigation training to address bias toward animal studies, a phenomenon called animalmethodsbias, and review groups will include non-animal method expertise. Lastly, the NIH will publicly report on research spending annually to measure progress toward reduction of funding for animal studies and increase for human-based approaches. This significant shift builds on steady progress at the agency toward the broader development and use of non-animal human-based methods. In 2024, the NIH accepted comprehensive recommendations on catalyzing non-animal approaches made by an advisory group, including many measures reflected in the announcement, like supporting non-animal method infrastructure and training and raising awareness of the value of non-animal approaches. In conjunction, a new program called Complement ARI was launched, aimed at speeding up the development, standardization, validation, and use of such methods. NIH investment in non-animal alternatives has steadily increased over the last couple of decades, but as much as half of the agency's budget still goes toward animal use, says Krebs. Today's announcement is exactly what the medical research enterprise needs to generate real change toward more ethical and effective science. The historic news comes on the heels of the groundbreaking April 10th announcement from the U.S. Food and Drug Administration to phase out animal testing requirements for monoclonal antibodies and other drugs. These changes are popular among the public. In a recent poll, 85% of Americans agreed that animal experimentation should be phased out in favor of more modern research methods. Physicians Committee experts have been working toward these changes for many years, advocating for the prioritization of human-centered research and the public reporting of funds going toward animal and non-animal-based studies, providing critical feedback regarding challenges and investment opportunities for NAMs, and leading an international collaboration of researchers and advocates aimed at addressing animal methods bias. Earlier this month, the Physicians Committee and 324 scientists, physicians, and other health professionals sent a letter to Director Bhattacharya asking him to lead the agency in the important shift away from the use of animals in medical research in favor of human-based science. You just listened to NIH's initiative to prioritize human-based research, a big win for animals, says Doctors Group. From Physicians Committee for Responsible Medicine at PCRM.org. And I'm your host, Marian Erickson. Physicians Committee, founded by Dr. Neal Barnard, is such an amazing organization. They have been working since 1985 tirelessly for alternatives to the use of animals in education and research, and for more effective scientific methods. So I'm so glad that they are behind this, as are many other wonderful organizations like Animal-Free Science Advocacy in Australia, who I also have permission to narrate from. But I will link some related episodes in the show notes, including 981, Elon Musk's Cruel Brain Experiments Under SEC Investigation. That one's by Physicians Committee. 870, The Fierce Battle to Stop a Massive Monkey Breeding Facility in Georgia. 869, History of the Anti-Vivisection Movement. And there are many, many more, so check the show notes for those, or just search for vivisection or experiments wherever you listen, or at plantbasedbriefing.com. And there's also a documentary that I really recommend. It's just a 15-minute short film called Test Subjects, and I'll link that in the show notes too. And please share this episode with anyone who might benefit, and thanks for listening.